Hello everyone, I'm Dr. Sabarapani, a general surgery resident, and today I have with me Dr. Zohaib Abbas Rizvi. Dr. Zohaib has completed his MBBS from UPUMS Saifai. He did his MS Orthopaedics from King George Medical College, Lucknow, and is currently doing his senior residency in KGMU, Lucknow. Hi, Dr. Zohaib, welcome.
Hello, Dr. Sabha.
Think from listening to your podcast during my preparation to finally having one with you. It's actually a pleasure.
For me to appearing on one of your podcasts. Seriously.
Yeah.
A lot of them, and I'm a very shy person. I think you brought me out of the cave and made me do this, to be honest. Thank you so much for that.
Okay, for all those who don't know, Zohaib has a very good podcast with all of our favorite, Abbas Ali sir, the bone teacher from Marrow. I will attach a link below just in case you all have not seen it. So, okay, coming to orthopedics. Like, I remember your podcast and you getting recorded for having a very good rank. So at that point of time, were you very sure of taking orthopedics, or did it come after the ranks, and what made you choose it?
To be honest, while I was doing my MBBS, I always thought of becoming opting for medicine, to be honest, because I was in complete awe of House MD, the TV series. It's a cliche thing to say, but if you're being brutally honest, that was the only inspiration that I had. Plus, investing your time in medicine was always fun, especially in the wards and during the clinical rounds and while going through Harrison and all. So I always wanted to opt for medicine, but it was only during my preparation phase when I dropped in a post my internship to prepare for my MS examinations, entrance examination. Only then did I had a clear picture, and especially also after my internship time, because internship gave me a lot of exposure towards the surgical fields, which usually people don't have during their MBBS days. So I don't know how internship works in a lot of other colleges and states in India, but I did my UG from UPUMS FA. So we had a really intuitive internship session where we used to appear on every clinical postings and rounds. We had to be there, and the surgeons and clinicians, all the faculties, they used to involve us into active learning and teaching. So I think that basically introduced me to the prospect of opting for a surgical branch. And while I was preparing, I was even pissed at studying for long durations. Like, I'm not that kind of a guy who could just sit and mug up things. I really don't. I have a completely different take to life. So I think all in all, at the end of it, even before my rank, I wanted to opt for a surgery to weigh in either for general surgery or for orthopedics. And later on, I opted for orthopedics. In fact, during my counseling time, also, I only opted for orthopedic surgery. There was no other branch that I basically put in.
So why did you choose orthopedics over general surgery? Like, being very frank, it is always such that if there's a guy who wishes to take up a surgical branch, he usually goes for orthopedics. So is that so, or did you have like any other personal reasons?
I didn't have a personal reason, to be honest. I basically went to my college back, and I asked a few of my seniors. I went to the wards. I looked up at the work the residents were doing. And all in all, I collaborated an idea, and then I weighed in the options that I had. And there were pros and cons in both the fields. But I think it's your own individual decision. I think no one can force it upon you whether you want to offer general surgery or for orthopedic surgery. Both of them are a completely different entity. And I think even if you want to offer general surgery like you have, and if you want for orthopedic surgery like I have, I think we can do well in our own branches. But yeah, it has to be your own idea. And you must have a rational decision and a rational thinking before opting for any branch, because whatever you're going to opt, you're going to live all your life by the choice that you're about to make. So it's really important not to make it as an emotional decision. Just sit back, think about it. If you are having any issues, try to consult your seniors, because obviously many of your seniors would be into those branches that you want to offer. Uh, but on a personal level, I think orthopedic surgery, I really wanted to offer it. And I today speaking as a senior resident in King George Medical University, Lucknow, I don't hold any regrets that I opted for orthopedic surgery. I completely love this branch, and I'm in complete awe for this branch. And I would really want other people to opt for orthopedic surgery.
I think one very important point that you said is to not choose anything emotionally. And it's like you're marrying the brand. So just get into it, work,
Yeah.
and then decide instead of listening to people. And that is a very important thing that everybody should do. I did it for myself before taking up general surgery as well. And because we came to KGMU, how was KGMU? Like, how was the PG life? Was it very heavy? Or, like, how was it? Did you get to play football?
I think I had a game after I passed my PG examination very recently, and I came. Yeah, it was a very revealing evening for me because I came to know that I just can't run anymore. I didn't have the capacity and the lungs and neither the legs to run and play football, to be honest. Answering the first question, I think we were from the 2020 batch of MS orthopedics, and at that time, Corona was at its peak. So the first year residency was completely ruined in terms of learning orthopedics, not in terms of labor or the work that we had to put in, because then we were posted not COVID wards. Frankly speaking, honestly speaking, I myself have contacted it thrice between all those three Corona peaks. But I think all in all, it was a really nice experience. And whatever happens, happens for a reason. And I feel good as of today.
So, do you think there is any difference between MS orthopedics and DNB orthopedics? So, people who are getting peripheral MS orthopedics, should they opt for DNB in a better institute in a bigger city, or how should they go about it?
I think getting it done from a good institute matters more than the MS part or the DNB part. Because at the end of it, what matters is how good you are in your field. It really has nothing to do with the MS degree or the DNB degree. Secondly, it also depends upon your own personal ambitions. Like a lot of people would really want to choose MS orthopedics no matter what college they are opting for, and they would just stop the idea of going for a DNB branch. Secondly, matlab, speaking on a very frank note, I think orthopedic surgery is not just those 3 years of the residency that you have, the junior residency phase. I think a lot of us learn a lot of things during our senior residency phase. So all in all, if you club it all together, I think 5 years of orthopedic residency is very essential. And I think we all learn the basics of orthopedics during these 5 years. There's nothing too complex. It's not a Christopher Nolan movie. It's a very simple and intuitive branch, and I'm looking forward to learning a lot of it. But I think if you have to weigh in for MS and DNB, I think you should choose in depending upon the college that you're going into, the faculties which would be basically teaching you, and the kind of clinical work which you're getting over there. I think all these factors you need to weigh in and then take a decision. Again, a rational decision, not an emotional one.
Not an emotional one. And what are the future options like? Is there MCH in orthopedics, or there are fellowships and subspecialties? How is it post MS orthopedics?
MCH is a relatively newer concept in orthopedic surgery, but yeah, in the coming 10 to 20 years, I think it's my assumption. I'm too little a person to comment upon what the future holds for orthopedic surgery. But yeah, in the coming future, I think the MCS is going to be a really weighed in prospect for orthopedic surgery. And secondly, there are a lot of fellowships. It's not just the ortho, but basically what the general public have an idea of orthopedics is that it's all about the bones break and you need to fix it. That is the trauma component. That's important. But apart from trauma, there are other cold branches of orthopedics that are really coming into they're really emerging. For instance, arthroplasty, arthroscopy, spine surgery, pediatric orthopedics. So there are fellowships. There are fellowships you can have anywhere across India. And if you want to learn more, you can go outside India as well, abroad. But yeah, it's basically an emerging branch. And I think if you look back at general surgery 20, 30 years from now, there were more MS general surgeries than having MCH, gastro, and neuro. I think it might happen with orthopedics as well, that in the coming 10 to 20 years, you might have a lot of people who are MCH pediatric surgery or MCH spine surgeries. So it is a relatively newer concept in orthopedic surgery, but yeah, it's a blooming branch, and I think in the coming next 20 to 30 years, it is going to have a really great impact on this field.
Okay, so what are the pros and cons in taking up MS orthopedics?
I mean, there's no definitive answer for it that what are the pros and cons of orthopedics. I think the most important pros would be that the orthopedics, though being an emergency branch, we don't deal with a lot of orthopedic emergencies. There are very few orthopedic emergencies which I can count on my fingertips, which I really won't gonna go into detail. But the workload in that perspective, where you are working in a tertiary healthcare center where you have a different subspecialty as trauma surgery and general surgery and orthopedic surgery. So I think in those infrastructure, the workload on orthopedic surgeons as an emergency branch is greatly reduced. Secondly, I think it is very rewarding compared to general surgery because once you learn, though the learning curve is steeper, but once you learn it, I think you earn more while putting in the same amount of efforts. But uh, there's not there's not a lot of disparity because it also depends upon your expertise and how good you are at your work. So it's not that general surgeons don't earn too much. I really don't want to go into that aspect because then I'll be receiving a lot of abuses from a lot of general surgeons I know. So no, I respect them
I
and I respect my
think
branch
of,
as well.
I think it's a very
Yeah,
subjective thing of who earns how much, and the reward thing as well. Like general surgery is very rewarding for me, so I think it's a very subjective thing of. But yes,
yeah.
having said
It is a subjective thing, but personally speaking, I wouldn't really want to go into the financial aspect of it. But looking around the world where we exist in, I think monetary output from the work that we put in is a very important driving factor that an individual chooses. Uh, so I think that's another important thing. And thirdly, I think it's a shorter course. So basically, you come into the field of practicing earlier compared to general surgery. Um, if and I think that's all. The cons of it would be that it's basically orthopedic surgery per se is basically saturating. There are a lot of orthopedic surgeons that are blooming out of good institutes. So it has reached kind of its saturation, but I think, like I told earlier, the subspecialties like arthroscopy, arthroplasty, spine surgery, pediatric orthopedics. There's a separate section for bone tumors as well. So all these branches are they're going to put in something good for orthopedic surgery in the coming times. I'm sure of it.
I also think that almost everything in today's world is saturated, and if you're good at it, then I don't think anybody should wear a branch according to the saturation, because people say ENT is
Yeah,
saturated.
personally speaking, I don't think that must be a decision-making thought. It's only for the fact that yeah, every branch is getting saturated, but then India has one of the largest population in the world, so there are even more patients that you need to cater to. So I
Makes
don't think
sense.
that's a decision-making factor.
I also have a very interesting question for you. What do you think about girls taking up orthopedic surgery? Like they say, usually there are boys who
I really want girls to opt for orthopedic surgery because it is
are the
not a muscle
orthopedic
demanding
department.
branch, to be honest. It is not a muscle demanding branch. Uh, you just have to understand the right technique of doing things. You really don't need to just bulk it up. Like when I joined orthopedics, I was 70. Uh, and I lost about 10 kilograms in the first 3 years of residency. So it's not that 60-year-old me couldn't give proper traction or couldn't do those stuffs. So I think girls basically don't choose it because they think it's too toxic. There's too much of masculinity. And thirdly, they think that there's too much of muscle into it. But I don't think any of it holds true in today's scenario.
Like I do have a co-PG of mine who's a female and doing orthopedics in my institute, and it's great.
Yeah,
But
it is great, but I think uh, none of the branches are gender oriented. It is just our personal choices that makes it that way. Like there are not a lot of male gynecologists in North India compared to South. So uh, it's not basically because of the demography, but it's also because of how a person opts for his branch. Whenever we are into our UG days, we just aspire to be a surgeon or a gastro surgeon or a neurosurgeon. So we basically see our seniors, they are blooming into thing, and then our priorities matter as well as to what we want to do. A lot of people want to just go into a particular branch because they think that it would be too much rewarding or they will be benefiting in terms of monetary out of it. So it depends upon your own individual decision. At the end of it, I think that matters. And what matters is your own satisfaction and your own happiness. You cannot put in anything else over it except for your family.
yeah, I think makes sense. I agree. And in the end, any message for all the aspirants who wish to take up MS Orthopedics as a branch?
Uh, the only advice would be the first year of residency is going to be a bit toxic, a bit harsh on you because you are basically walking into or trading into a completely different world. So uh, getting accustomed to it, I think that's more important. Whether you're opting for general surgery or orthopedic surgery or for any branch, I think once you prepare for your PG and then you get that honeymoon period of 3 4 months where you are just lazing around, doing nothing at all, making trips at different places. After that, coming into a branch where it's pretty much demanding, you need to be on your toes at 24 hours a day. A lot of people depend upon you, and you need to be accountable for them. So I think you need to keep that in mind. The first year is going to be really important. It is going to be harsh on you, but ऐसा भी नहीं है कि you won't survive. Everyone who is a JR3 was a JR1. Everyone who was an SR was a JR1 once upon a time.
Yeah,
So it's like
I think it
क्योंकि
stands true
सास
for
भी कभी बहू थी kind of thing.
yeah, and I think it stands true for all the branches, be it orthopedics or anything else.
Yeah,
First year
it
is
stands for all the branches. I think personally you should be determined enough of doing good in your field. ये मैं ऐड करना चाहूंगा कि लास्ट में कि toxicity doesn't comes with the prospect of your senior or your consultant scolding you. It basically comes with the fact that you need to cater to the needs of the patient that are admitted in the ward. If a patient with compound fracture is admitted in orthopedics ward, you need to dress the wound because uh, the plan for the definitive management of the patient might change if you're not doing your work properly. So you need to be responsible for those things. And in those terms, a lot of people they're not invested into the field. They just take it as a basically under peer pressure, or it's not their rational thinking. They choose it emotionally. So I think you need to be interested in the branch you are going to choose because that is going to determine how well you are going to do during your residency and in life later on.
all right, Dr. Zohaib. I think you have put everything very well, very natural and raw, very nice for everybody to understand. Thank you so much for being here.
Thank you so much, Sabha, for having me. But
Yeah.
on an ending note, I think for anyone who is confused between choosing for general surgery or orthopedics, they must put in what they want in life first before thinking or consulting someone else. I think your priorities matter the most to you, and no one else apart from you would understand that. So whatever you're going to do in life, take a decision and be rational with it. Do not be emotional. consult your friends and family members, but then do what your heart says.
I think that was a very good note to end on, because this was the case with me where everybody told me to take up obs and gynae over surgery. But
My
finally,
younger sister, she wanted to opt for general surgery, but
haha,
it wasn't on that someone forced her to choose for OBGY, but she chose OBGY and she's pretty much happy with it. She's here only in KG. She's a third year resident now.
I'm glad. I'm glad. But yeah, I think we should always choose what our heart says. That is what I did and you did, and that is what everybody should do.
Yeah,
I
everyone
think,
should do that.
thank you so much. Bye.
Thank you so much for having me. Bye.